All right, guys, Jeremy here with the Hospital PT. Today in the video, we're going to cover 5 things I wish families knew before discharging from the hospital. Okay, 5 areas that are often overlooked. We're going to cover some questions to ask. As you approach discharge, we're going to cover um, 5 uh, items to ensure that you have in your hand, or at least accounted for before you discharge. Okay. So you've seen my videos in the past. If you've been on my channel for any length of time, uh, you know that I'm an acute care physical therapist. I work in a hospital, and it's no secret if you spend any time in a hospital, hospitals feel rushed now. Okay, hospital staff, they're trying to get you in, get you stable, deal with whatever medical complication you've experienced, whether that requires surgery or new medicines or monitoring for a period of time, and then discharge and go and get out of the hospital to the next best discharge destination. Okay, and I will tell you that what I'm seeing now is that because insurance reimbursement rates are so high, I mean, I'm so high. We wish they were high. Uh, Insurance and reimbursement rates have dropped. The amount of folks that are being denied rehab placement or skilled nursing placement has increased, and hospitals are left to pick up the pieces to provide the care that's needed, but also um, try to uh, try to facilitate home discharge because it's obviously you don't require insurance approval to discharge back home. Okay, so that's kind of the long and the short of it there. So hospitals are really pushing for home first discharges, and they are making hospital staff like myself um, justify to the 10th degree why someone needs to go to rehab. And we're trying to do that. But even when we try to dot every I and cross every T, uh, we are still faced with insurance denials periodically. So you may be experiencing that now. You may have experienced that in the past where, your doctor, the therapy staff, or whoever the part of, all the members of the care team have said, hey, you need to go to rehab or you need to go to skilled nursing care, and your insurance just says we're not paying for it. And so now you're left with, I got to go home and make it work at home. And so what I'm hoping to do in this video is give, if you're a caregiver for an aging parent, for a spouse that's been infirmed for whatever reason, give you 5 aspects to consider and account for as you approach discharge in the hospital. Okay. And so here's number one. Number one is being medically stable does not mean that you're functionally safe to go home. Okay, I've spent multiple videos talking about that, and so remember, hospitals focus on vital signs. They focus on medical stability. Is the condition for which you came into the hospital, is it stable? Okay, a way to ask it in the negative would be, is this patient at risk for imminent deterioration or death if they discharge from the hospital? Okay. And those questions need to be answered. But the problem is that if a patient is medically stable, that does not guarantee that they are functionally safe at home and can go home and mobilize alone safely, or sometimes even mobilize with a caregiver safely. Okay. So my job as a PT and the rest of the rehab staff is to assess real life function, like walking, bathroom transfers, stairs. Uh, can you get out of the bed by yourself? What's your balance like? What's your endurance like? Do you get tired just walking 20 feet or so? Those things matter in real life once you get back home. Okay. So remember, medically stable does not mean functionally safe. That's number one. Number two, um, you need to ask about and consider what the realistic recovery timeline is for someone who has been infirmed. Okay, most people think, and they want to bounce back quicker than they will in reality. Okay, weaknesses and issues and impairments from a hospital stay can last multiple days, most of the time weeks, and sometimes into months. Okay, and so it's reasonable to expect good days. It's reasonable to expect bad days as well. And so um, you have to have realistic expectations about what your capabilities are, or what your loved one's capabilities are once they discharge from the hospital. Okay. Number three, medication changes. Okay. About 50% of patients that discharge from a hospital experience complications with their medications within the first week. That's just the way it is. And especially if the more medicines they take, the more complicated it gets, because most medicines have, some medicines have specific dosages and specific frequencies with which they have to be taken, and that can be convoluting to keep track of for someone who has recently been in the hospital, and maybe you're dealing with an aging parent, and we all know that most of the time our ability to keep complicated things straight doesn't improve as we progress in age. Okay, so that's just a fact of the matter. And so we also know that polypharmacy, so taking more than one medication, and the number here, the cutoff number is like six. Over six medications, prescription medications, increases someone's fall risk significantly. Okay, because you run with more medications, you increase the risk of like medication interactions having deleterious effects on a patient. Okay, or if you have more than one blood pressure medication, one is to be used every day, certain times a day, maybe, and one is only to be used as needed if your blood pressure is real high. Well, if you don't keep that straight or you mix them up, they have different strengths, different potencies, and different mechanisms of action. And so you can have a situation where someone's blood pressure bottoms out, they get dizzy, they get lightheaded, they pass out, and they fall, hit their head, break a leg, break a shoulder, or something like that. Okay, so that's number three, medication changes. You have to be mindful of them. All right. Number four, this is the fourth thing to keep to consider as you approach discharge: home safety. Okay, I've spoken at length about that in prior videos, so feel free to reference those videos. But home safety is paramount to consider. Okay, you got to remove rugs, add night lights, make sure lines of sight are appropriate. Okay, grab bars in the bathrooms, no slip mats in the bathtubs. Do they need certain equipment, and so on and so forth? Okay, those things need to be considered before you get home. Okay, so if a PT or OT or someone in the rehab staff has recommended specific equipment or home health, home health services to come in and assist, you need to really, really, really attempt to follow those recommendations and fight for them, because having the appropriate equipment available and having the appropriate assistance at home can really reduce and lower the risk of an adverse event taking place. All right, so that's number four, home safety. Number five, and this one catches people by surprise, but it's a real thing, and I see it all the time in the hospital. Caregiver burnout is a real thing, and it needs to be considered. Okay, you cannot pour from an empty cup. That's an old adage that I've heard for a long time about multiple things. But if you're a caregiver and you don't take care of yourself, eventually something's going to go wrong with you, and you will not be able to take care of your loved one. Okay. And what's interesting is about 60% of people who are full-time caregivers report high emotional stress and high burnout rates. Okay. And if you think about it, it makes sense. Taking care of someone and making sure that they have food, that they get cleaned, that they go to the bathroom, that they get dressed, that they get to and from appointments, and all while trying to maintain some sort of dignity for them, it's exhausting because that job doesn't stop. Okay, it doesn't stop, and it's something that has to be considered. All right, so remember, I have videos on this channel about appealing denials. Guys, if you are a caregiver of a loved one in the hospital, and you do not feel safe taking care of your loved one at home because of the nature of the impairments that they have, that you have heard from the rehab staff, that you see with your own eyes in the hospital, you do not have to accept the denial. You do have the right to appeal. Okay, you do have the right to appeal, and shameless plug here, but there's data to back this up. Um, you need to really tap into the expertise of the rehab staff. Okay, we are uniquely positioned in the hospital to be able to speak to the ability of someone to function safely at home. And not only do we talk about how that patient can function safely at home, we also consider the caregiver when we think about, is home discharge a safe or effective option? Okay, so utilize the PT and OT and ST resources that you have available to you if you find yourself in the hospital. Okay, because when PT and OT recommendations are followed, readmissions reduce significantly, something in the order of like 2.8 times a reduction in readmission rates. Okay, now how do you prepare if you're in the hospital and you're looking at discharging in the next day or two? What do you need to do, or how do you prepare for the discharge? Okay, so here's a pre-discharge checklist for things, information that you need to have before you discharge. Okay, number one, a written discharge summary. It kind of states what has happened in the hospital stay, what the diagnosis was, and what the plan is for the specifically the first like week or two after discharge. So follow-up visits, any discharge instructions are going to be in there, and then also, and this is important, a medication reconciliation list. Okay, is there a new medication? Have more than one medication been added? If so, what's the dosage? What's the frequency with which they need to be taken? And that's very important. And like I mentioned earlier, this is number two. You need to have any follow-up appointments that are relevant to the issue that you had in the hospital, or that the patient had in the hospital. You need to have follow-up appointments scheduled within the first week of discharge. Okay. Number three, you need to have your equipment ordered, or make sure it's ordered and either delivered to the hospital or delivered home so that it's ready and waiting to be able to assist the patient when they need it the most. All right. Number four, is it going to be, is the patient going to receive any therapy in the home? Or are they going, are they going to have home health physical therapy or occupational therapy? Or are they going to have outpatient therapy services? Those two things are very different. Home health therapy is provided in the home. Outpatient therapy requires the patient to be able to be transported to a clinic and to receive therapy there. So see my former videos on the different discharge destinations if you want more detail on that. And then lastly, you need to have an emergency contact. There needs to be an emergency contact on the in the patient's discharge summary, and you need to have a clear when to call the doctor list. Takes a little bit of guesswork out of it, right? So I know a common one is after someone has had surgery, any fever over 101 needs to be the operating physician or surgeon needs to be notified immediately. Okay, because it could implicate infection, or that could be evidence of infection beginning. All right. So that's your pre-discharge checklist. I'm going to go through them quickly. A discharge summary with a med reconciliation list. Follow-up appointments, ideally scheduled within the first week after discharge. Number three, all the equipment needs to be ordered and ready to use once the patient gets home. Number four, is there going to be home health physical therapy services or outpatient physical therapy services? Number five, you need emergency contact information and also a clear when do I call the doctor list. Okay, and that's gonna differ depending on what the situation is contextually for the patient and what they are experiencing in the hospital. Okay, now here are 5 questions to ask before you sign discharge papers. Okay, number 1, what is the realistic recovery timeline? Are we looking at a week? Are we looking at 2 weeks? Are we looking at 6 months? Okay, you need to know that. Number 2, what symptoms mean that I call the doctor immediately? So we're reiterating what should be present in the discharge summary that I mentioned earlier. Number 3, has the ability of my loved one or the patient to function safely at home, has it been fully assessed by the appropriate staff? Physical therapy, occupational therapy, speech therapy, so on and so forth. Number 4, okay, the plan was for home health or some sort of rehab. What has been scheduled? You want that information told to you by the hospital staff before you discharge, okay? And again, that should be in the discharge paperwork, and that should be a tangible, uh, packet of papers that you receive that has that information in there. But you want to hear it as well, because repetition in all this is how we know that we're all on the same page. All right. And then number 5, who's going to support me as the caregiver? Obviously you. Who's going to support the caregiver so that they don't burn out? Because like I said, caregiver burnout is a very real thing, and it affects people immensely. If you don't believe me, see my last patient story video about the lady who was attempting to help her husband and had an accident and fell, and she had to be hospitalized as a result of it. Okay. So again, guys, I, I don't share these videos to scare people, but you need to be sober minded and know that it's oftentimes more complicated than we think, just discharging directly home from the hospital. And if we don't think about some of these things that I've covered in this video, all of a sudden you're forced to think about them when they become an issue. Okay. We know that if you account for these things, it serves to make the transition back home smooth, or more, or as smooth as it can be. Okay. And it reduces the likelihood of there being some sort of adverse event that will require a readmission to the hospital. Okay. And I can't say it enough. If you're a caregiver, you have to account for and protect your own health. Okay. Schedule breaks, reach out to extended family to come in, just give you an hour or two just to be able to go run an errand, go sit by a pond, go take a walk, whatever it is, go take care of things you need to take care of. Because the fact is that caregivers need support as well. And oftentimes the caregivers that feel they're the strongest, they too need support. Okay. So if you're watching this video and you are part of an extended, you have some extended family that has, a loved one that has been recently hospitalized, and you know that their spouse is, or that there's a spouse that has recently had maybe a cousin or a distant aunt or uncle that you don't really talk to that much. If you know they've recently gone through a rough patch and have been in the hospital, check on them, reach out to them, offer to give them, an hour break or 2-hour break or anything. It doesn't have to be all day. It doesn't have to be spend the night necessarily. But any break oftentimes is welcome for folks who do it day in and day out, for their loved ones. Okay. So, save the video, go back and reference, those kind of list of things that I went through. I'm going to do my best to try to put together a more, a concise kind of, caregiver, survival kit, if you will. I don't really know if that's what it's going to be called, but I'm just kind of thinking off the top of my head, kind of a document of things to, look at and keep in mind, and be able to reference directly instead of going back and having to mine through a lot of my videos, for some of this information. Okay. So, that's it for now. Okay. Remember, like I always say at the end of especially my last probably 3, 4, 5 videos, you can't go wrong getting strong. All right. You can't go wrong getting strong. Strength is how we interact with the world. And it gives us a big buffer zone between, being, needing help and not needing help. Okay. And as we continue in this channel, we'll cover the importance of the different physical capacities and things like that, and why strength is so important. So remember, guys, like I'm here to help. Reach out to me, in the comments. Maybe send me a direct message if you can, and I'll do my best to answer any concerns or questions that you have. And like I said, you can't go wrong getting strong. And until the next video, you guys take care.